Hey guys, my name is Brent. I'm a licensed professional counselor, and today I'm trying something a little bit different on my channel. I wanted to do a React video. Now, I want to do it a little bit different than what I've seen before in that I want to be respectful. I am a professional, and whoever I'm reacting to, they are people just like anybody else. And so it's important to continue to look at the positives. And even though if you may disagree with something, point it out and make a point of it, but also don't treat them lower than dirt just to make you look good. You know, that's sort of my 2 cents with React videos. So it's a little bit different than what you may be thinking, but it's still informational. So if you're interested in that, then definitely stay tuned. And we're going to be looking at Dr. Phil just sort of looking at sexual addiction. I'm a sex addiction therapist, and so I found this little short clip and I wanted to basically use it as an opportunity to sort of disagree with him in a sense, but also point out where he is right as well. So if that sounds good, then stay tuned. Remember to click that subscribe button and subscribe to my channel. Okay, so I found this clip on YouTube. Obviously, Dr. Phil explains why sexual addiction isn't a recognized disorder. You can see the link in the comment section below. I will put it. And just to clarify, it is a short clip. It is not the full episode. I may do the full episode later on if there's any interest in that. But I found this one clip and I wanted to utilize it to talk about some good points and maybe some points that I disagree on, right? Okay, so let's get to it.
Now, is this an addiction? I'm going to be honest with you about some things that are unclear. This is a very controversial thing.
Yeah, he's
the
right.
best
It is controversial
kind of definition that I can tell you is hypersexual disorder is a controversial diagnosis or proposed diagnosis, and it is not included in the latest version of the DSM.
Okay, so he's right. Sex addiction is not included in the DSM, and it is not recognized as a actual disorder, and meaning that insurance won't cover treatment necessarily. So with that being said, my point to that is that there's a big push to get it added to the DSM because there are so many other actual disorders when it comes to addiction, such as, alcoholism. There's a bunch of variants, different things like that. So I'm not picking on alcoholics. There's tons of other disorders, cannabis use disorder, which is controversial because lots of places are legalizing marijuana now. And so there's just multiple controversial subjects, and the DSM is just an agreed upon book that we use to diagnose. And so, okay, he is right on this subject.
In the previous version, a diagnosis referred to as sexual disorder, not otherwise specified, was applied to situation in which a person experienced distress.
I want to point out this guy is completely distressed right now. I know that they're talking about it, and so he's going to point out in a few minutes, or maybe in a minute or so, that distressed about a pattern, and he makes a point here. But this guy is obviously distressed. It doesn't have to necessarily be a physical distress, and so I'll talk about this in a minute. So let's keep going.
About a pattern of repeated sexual relationships involving a succession of lovers who are experienced by the individual only as things to be used. Now, here's the issue. Distress about a pattern of repeated sexual relationships. I spent quite a bit of time asking him,
right,
before he was caught,
right,
was he distressed by this, or was he rolling along and enjoying it?
Oh, he was enjoying it, absolutely.
And he made it very clear he wasn't distressed by it.
I will point out, you have to look at the definition of what distress is. And I want to also point out that in the moment that you're engaging in these sexual behaviors and you are engaging in all of this stuff, there are multiple different reasons that one may do that, but it does cause distress in your life. And so if you're trying to maintain your relationship, so this guy, I don't know the whole story here, but if this guy is trying to maintain a relationship with his wife, maybe they have kids, whatnot. If he is trying to maintain that and also seeking out all of this stuff, he feels like he's living a double life. We don't really know necessarily what's going on in his head. That's not made clear in this clip, but I've seen it over and over and over again, is that there's just this disconnect. And so it's basically, I'll label it to dissociation. You dissociate, you get into this fantasy mindset, you get preoccupied, you're preoccupied with thoughts about, acting out, whatever you may be doing. I don't necessarily know what this guy is doing here as far as his sexual behavior, but I will guarantee, I can't guarantee, I will really bet that he was distressed, but didn't even realize that he was probably distressed, and so there's that shame and guilt cycle that hits you whenever you're in those moments and you're really trying to, you feel this shame come over you. I'm not this good person. I'm this horrible person. I'm guilty for what I keep doing. But then that actually feeds the cycle and the loop in the future anyway. And so, that's the thing, is that I think that obviously Dr. Phil, I'm like I said before, I respect him. He's a psychologist. Not to get into all the controversy that happened with his license and everything, but he is a psychologist. And so the psychologist community, mainly those responsible for making the DSM, have this sort of mindset. But he even says, maybe in this video or another video, that, he has a lot of respect for those people who do believe, but this is his viewpoint, and I think it's very good to be able to do that, like I'm doing right now. I respect his viewpoint, I understand that, but I wanted to use this to propose an alternative thought on this whole thing. We don't really know what's going on with this guy, but I'm telling you, I've seen it over and over and over again. That shame and guilt hits you, and it actually keeps you in that addiction cycle. So let's keep going.
Right. He was only distressed when he was caught.
He had a problem being caught.
Right.
Does that mean that what he's doing is not self-destructive? No, it is self-destructive. Does it mean it's not change-worthy? No, it is change-worthy, self-destructive behavior. And I don't believe he has a clue about what to do about it, how to attack this, how to get things where they need to be. And whether you stay with him or whether you don't, he is the father of your children. And so it's worthy of attacking that and trying to change it.
Okay. Everything he said at the end was right. It is something that he probably doesn't even know what's going on. But like I said before, that there's so many different layers to this, and there's so many different behaviors. There's so many different situations. You have no idea. And so I do think that it's very difficult to slap a label and say, everybody that struggles with sexual issues or everybody that cheats is a sex addict. No, but there are people who really do struggle with sexual addiction, whether it be, looking at porn for 4 or 5 hours a day, or, going through multiple women over the course of a whole week. I've seen it. I've worked with it, and so when you see it, you really know, like, okay, well, then maybe this is actually legitimate. And there may be different explanations and obviously different opinions, but in my opinion, I think that this is definitely something that is warranted. So anyway, I hope that this helps you in a way, but it really just proposes a point. Is it or is it not a disorder? Not yet, but could it be? Maybe. I really do think it could be. eventually, and I know that there's a big push right now for that. So as a CSAT, I do believe that that's going to happen. I just don't know when. I'm not sure when the DSM-6 comes out, but things change. So, things change over time, and I do think that there will be a lot of revisions when the DSM-6 comes out. Going back to the DSM 3, there was a lot of controversial things. If it were still in use today, that would be on there. Not to get into all of those details, but there's always importance for changing and keeping pressing forward. And so we'll be interested to see when that DSM-6 comes out, if things will change and sex addiction actually gets added to the DSM. So thank you for watching. I may do more. If you're interested, definitely subscribe to the channel. If you're interested in me doing more of these in the future, I can do maybe the longer video and or different alternative videos. I'm not going to sit here and do Dr. Phil stuff all the time, but whatever it may be, I just want it to be informative, helpful, respectful of whoever's content that it may be, and just to propose talking points like now, like we've done, and yeah, I really think it's going to be good. So click that subscribe button. I look forward to seeing you on the next one.